Hello friends, this is your friend Dr. Baljeet Mani once again with an important topic. Friends, we know that the word cancer is very terrifying and we never want that anyone or any one of their near dear ones should suffer from any form of cancer. And world over, we are searching for a vaccine which eliminates all the cancers. And with the good news, I am beginning this talk that we have finally found a vaccine that can eliminate the problem of cervical cancer from this country and entire world. So this vaccine is against cervical cancer. Cervix is a narrow part of female reproductive tract, small part of the female reproductive tract, and it is between uterus and vagina. This portion gets infected with the virus called human papillomavirus, and this infection turns into cancer in some of the ladies. Now this topic is very important because more than 6 lakh cases are annually detected with more than 3.5 lakh deaths occurring annually, with more than 90% of the load in country like ours. India is the huge center for this problem and contributing nearly 20% of the entire load. In India, the cervical cancer is the second most common cancer in women. Most of the cervical cancer is caused by human papillomavirus, and very few cases are caused by other factors like smoking, obesity or immunosuppression. If we see globally, the occurrence of cervical cancer by HPV represents only the tip of the iceberg. That means there are a huge number of HPV infections already affecting the population as against the number of the cancer cases. So, the natural doubt that arises in mind is, will the cancer occur tomorrow if the infection occurs today? No. It takes usually a very long period of time, normally 15 to 20 years, for the normal cervix to turn into a cancerous tissue. First, the virus infection takes place, then it develops some pre-cancerous lesions in some ladies caused by mostly type 15 and 18 types of virus, and if it is gone undetected, it will turn into invasive cancer in some ladies. So earlier we used to have a cervical cancer screening program. That means when already the damage has started occurring, to detect that, but now we have another layer of protection called HPV vaccine, which will inhibit the entry of the virus in the body system. This vaccine is very effective and it has been proven that now it will be reducing more than 90% of the cancer load in many of the Western countries where this vaccine has already been given over the last 20 years. It is nearly 100% effective in providing immunity against the serotypes of virus for which this vaccine is made, and more than 500 million vaccine doses have already been given safely. So this is the time period when we should give the vaccine. As you can see in this timeline, we saw that the window of opportunity is when the HPV infection occurs, and as we know that the cervical cancer is a late occurrence thing, but our society is seeing a early sexual exposure phenomenon. So that means before the first sexual exposure, we should be giving this vaccine to all the girls so that the infection does not reside in the body. We have various forms of vaccine. Most common platform which already exists for the other vaccines of our country. Now, some people worry about side effects. They are usually mild and temporary, like some pain or swelling in the area of injection, or some maybe fever or headache in some cases. Dizziness and fainting has been reported, but it is not a concern because it is usually harmless and patients should be made to sit or lie down for 15 minutes after the vaccine. And these side effects appear nothing if we see the lifelong protection against some deadly form of cancer that this virus can give to us. WHO says to have a 90-70-90 master plan. That means 90% of the girls should be vaccinated by HPV vaccine by age of 15. By the age of 35 and again by 45, more than 70% of the women should be screened for cervical cancer. And those who have been diagnosed with any form of cancer in cervix, 90% of the ladies should receive some form of the curative treatment. Some words about the cervical cancer screening, which already exists, but we should remember that screening is for those lesions where the damage has already started occurring. So that means, should we mean that screening is not required when the HPV vaccine has been given? No. HPV examination can be done and the patient can be then fully diagnosed whether it is a cancer or precancer or a normal tissue. Some red flags for all the females: if we have any abnormal vaginal bleeding between the periods or after menopause or after sexual intercourse, if we have any foul smelling, very abnormal discharge from vagina, if we have a deep pelvic pain or pain after sexual intercourse, any unexplained fatigue or weight loss, then we should always be consulting our gynec doctor for further assessment, because pre-cancer lesions do not lead to any significant symptoms. If these symptoms have started occurring, it means that damage may be very significant inside. So friends, we don't want to enter in that dangerous forms of cancer. Any lady should not develop that, and now we should be having a pledge that we should be using both the arms of vaccination as well as cervical cancer screening, so that this malady can be eliminated from our world. I have made this talk using the resources provided by WHO, Center for Disease Control, Atlanta, Indian Council of Medical Research, and other important medical resources. So friends, I thank you for watching this video till the end. Please leave your comments in the comment section, so that what do you like and dislike about this video, and you can suggest me other videos to make. Plus, I request you that we should share this video with all the relatives, all the friends, so that all people, all ladies who are eligible for this vaccine should get the vaccine, and all the ladies should be prompted for cervical cancer screening regularly. Thank you for watching this video. Thank you once again.